Yeah, no. Is it fine, ma'am?
Good morning, everyone. నేను తెలుగులో మాట్లాడాలా ఇంగ్లీష్లో మాట్లాడాలా ఐ గివ్ ద చాయిస్ టు యూ. ఎందుకంటే నేను చెప్పేది మీకు అర్థం అవ్వాలి సార్. ఓన్లీ లాంగ్వేజ్ ఇంపార్టెంట్ కాదు. మ్యామ్ ఏ లాంగ్వేజ్ చెప్పండి. ఓకే, ఇంగ్లీష్ and తెలుగు కలిపి మాట్లాడతాను. Once again, happy International Women's Day. And this is the theme for the year 2023. Every year they come with a theme. Sometimes once in 2 years they keep coming with new themes. But for this year, this is the theme. Okay? Embrace equity. Right? So many people think women are equal to men. మీరు ఒప్పుకుంటారు మేడం, ఉమెన్ ఈక్వల్ టు మెన్ ఒప్పుకుంటారు? I don't agree. I believe they are much superior to men in many aspects. Right? That's why I don't believe in that statement. Equal opportunities రావాలి. I don't believe in all that. Okay, maybe physically you are maybe a little vulnerable or కొంచెం weak ఉండొచ్చు కానీ, but emotionally, mentally, in every aspect, you are much ahead with men. Okay, and you looking at embrace equity. That sentence for a healthcare person, the doctor, that sentence looks very incomplete for me. Right? So I added few more words. So what I added is embrace equity in healthcare. Okay? So I'll tell you the reason why I added these two words there. Because when we are going forward, you see, there is a lot of lacking in, a lot of gap in healthcare when it comes to women. So this is a news slide actually I added last night, so it's not very perfect. So this is me. So the basic topic is let's be aware of cancer. And every year November is celebrated as, or November is observed as National Cancer Day, and there are so many other awareness programs going on that month. Lung cancer, male cancer, so many cancer topics keep going on that day. See, look at this ribbons. Every day you wear so many ribbons, but you are not aware that WHO has given so many colors to each different type of cancer. The different types of cancers, for each type of cancer, a color is given. This is mainly to create awareness regarding that particular cancer. So, why we are talking about cancer today? I want to keep it an interactive session, okay? I don't want to do a lecture. Anybody can answer, okay? Why we are talking about cancer? See, previously, 10-15 years back, if someone wants to do a cancer lecture, people are not willing to listen. So they used to tell, sir, we want to talk from cardiologist, we want to talk from sugar doctor, we don't want cancer doctor, sir. Okay, because at that time, it was scenario was like that. But last 20 years, the scenario has changed. They, see, most of you are not even born at that time. If you just look at the history, you know, Madam Padmasai, Madam and Sir would be aware actually. People used to, in early 50s and 60s, people used to die with tuberculosis. Right now, you won't be listening to that word, I guess. But before that, people used to die with diarrhea. So when it comes to 70s and 80s, people used to die with HIV. Then later again, when it comes to 90s and early 90s, late 90s, late 80s, early 90s, and all people used to die with heart diseases. But since early 2000, more and more people are dying with cancer. Yeah, no problem. Absolutely. So this is the reason why I wanted to give a talk about cancer, because no, we are seeing it very closely. Previously, we used to hear from someone somewhere. We used to listen. Okay, somebody's friend's mother or some friend's father, or relative, some distant relative got cancer. We used to hear like that. Now it's not like that. Since last 20 years, we are seeing in our own families, friends, relatives. We are constantly seeing the people around us suffering from cancer. We are losing people for cancer. And maybe when I was doing my post graduation 20 years back, at the time we used to read, okay, only this particular age group of people you get cancer. Only especially cervical cancer వస్తే 55 years above వాళ్ళకే వస్తుంది. ఎలా there was some pattern which we used to study in the textbook. Ma'am, disturbance ఉందా? Ma'am, any doubt or anything clarification, please raise the hand number. So, but now what is happening? So every year or every decade, usually when it comes to medical terms, we study the data in terms of decades. How is the pattern in last 10 years? Because every year we can't have the adequate data. So every 10 years, the number of cancer patients are doubling. Not only that, the most important thing why today I chose to speak to you people is the reason is that you people are going to be ambassadors. The same thing what sir and madam were telling. You people have to create awareness among your own family, right? So not only the number of cases are increasing, young people are getting diagnosed with cancer. So what I was telling in the textbook, we used to read some cancers to come at 50 years, 60 years, but that is coming as early as 30 and 35 years. So that is the significance of cancer now. And cancer is the leading cause of death after accidents. When it comes to health, cancer is the leading cause of death. Once upon a time, maybe 2 decades back, it was cardiac problems, but now cancer is the leading cause of death. So today we just try to understand the basics of cancer. See, just look at this slide. So what did you understand? Exactly. Yeah, Asia is contributing to almost 50% of world cancer cases. And when it comes to India, every year 10 lakh new cases are diagnosed. And this is something, this is one of my favorite slides. Like, just see the slide. What we are seeing, the cancer pattern is different in different parts of India. Indian subcontinent antam kada. Not only food habits from the climate malanga, the lifestyle malanga, the food they eat, different parts of India. Northeast has different types of cancers. North India has different type of cancer. South India has different type of cancer. Kerala has different type of cancer. The cancer pattern is different throughout India. It's not same throughout India. So what is cancer? I will not move from this slide unless you answer. I will stand like this. Yeah, anybody can answer, no problem. Teachers, faculty could answer change.
Cell growth.
No. Cell growth, is there anything? Students, you can speak here, don't sleep. I know today is holiday. Good. See, actually what happens, yeah, it's not exactly unrequired. So yeah, you are almost near to the answer. What happens in our body, every organ has a particular growth pattern. What ప్రతి organ కి ప్రతి భాగానికి particular growth pattern. అంటే ఎగ్జాంపుల్ స్కిన్ ఉంది అనుకోండి. Every 3 weeks we get a new skin. మనకు తెలియదు కూడా తెలియదు, ప్రతి 3 వారాలకు కొత్త చర్మం వస్తూ ఉంటుంది. అలాగే గ్యాస్ట్రో ఇంటెస్టైనల్ ట్రాక్ట్ లా డిఫరెంట్ పార్ట్స్ లో డిఫరెంట్ ప్యాటర్న్ ఉంటుంది. అయితే ఎప్పుడైతే ఆ ప్యాటర్న్ తప్పి, ఎగ్జాంపుల్ నేను చెప్పాం స్కిన్ సెల్స్ వన్స్ 3 weeks వస్తాయి. ఆ 3 weeks కి వచ్చే బదులు 2 weeks 10 days వచ్చింది అనుకోండి, కొంచెం ఏమైపోతుంది, దాన్ని క్యాన్సర్ కింద మారుతుంది. దాన్ని క్యాన్సర్ అంటే అన్కంట్రోల్డ్ గ్రోత్ ఆఫ్ సెల్స్ అనమాట. క్యాన్సర్ ఇస్ అన్కంట్రోల్డ్ గ్రోత్ ఆఫ్, అంటే దట్ విల్ బి అవుట్ ఆఫ్ రెగ్యులేషన్. it will go beyond the regulation and it develops cancer. అంటే ఏమవుతుందంటే బాడీలో we have immune system. Every day hundreds of cells, unwanted cells, somebody was telling now, some unwanted cells or abnormal cells are developed. They're developing constantly. And these cells are constantly removed from the system. అంటే మనం తెలియట్లేదు మన బాడీలో ఇంత జరుగుతుందో మనం తెలియట్లేదు అంటే కనీసం కొన్ని వేల abnormal cells ప్రొడ్యూస్ అవుతూ ఉంటే దే ఆర్ కాన్స్టెంట్లీ బీయింగ్ రిమూవ్డ్ బై ద ఇమ్యూన్ సిస్టమ్. సో ma'am, what is the naughty kid? What does naughty kid do? Ma'am, shall I pass on mic? Anybody can speak, no problem. Somebody wants to have mic?
Definitely.
See, teachers have different view of a naughty kid. Students have different view of a naughty kid. Okay, అల్లరి అంటే ఏంటి చెప్పండి? ఓవర్ యాక్టివ్, ఎస్. ఇంకా ఇంకా లేదు మ్యామ్, ఐఎమ్ నోటింగ్ యువర్ పాయింట్స్. యా, only 2 points, sir. Students must speak here. Nobody is speaking. You can speak anything, no problem. You must be having naughty kids in your class, right? Boys, girls. Stubborn water. Okay, one more point. Okay. Yeah. Okay, fine. Now, see why I'm asking about naughty kid is the cancer cell is similar to a naughty kid. What does naughty kid do? Just somebody told hyperactive, stubborn, won't listen. So what does this cancer cell do? Same thing. It doesn't listen to the regulation in the body. Yes, it is stubborn and it disturbs. Not a shooting is that he'll disturb the bench there. If he'll disturb that particular part, that fellow not only disturbs the bench, he'll disturb the whole class. He'll go to next class and disturb the next class also. Right? So that's what cancer cell do. There's something else you are missing. One point, okay, and we are expecting one more answer. Naughty kid, no, what does he do? He also snatches fruit from your friends. No, doesn't he do like that? Cancer also does the same thing. No, it snatches fruit from healthy cells. That's how it grows. So we call it as a hallmark. Same whatever I told, it is just the hallmark of cancer: growing, abnormal growth, uncontrolled growth. And there's one more thing a naughty kid does. Actually, not getting answers from students. Ma'am, what is this? Your students are not talking. So what is one more thing? The kids are very smart. What does the naughty kid do is? Hey, you come here. You tell me. They're not speaking. One tell what you must be having some naughty friend right in the class. What he does? One word. Some mischief he'll do. He'll do some mischief and he'll escape. Exactly. No, he'll escape from the teachers. He'll do something mischief and escape from the teachers. Same thing what the cancer cell do. It is there, but it has something. No, we think body is simple functioning. Cancer cells are simple, just growth. It's not like that. Cancer cells are very smart. They have something called masking. Our body, what it is, when our body finds out abnormal cell, immediately we have something called T cells. They are like police of the body. They'll immediately catch them. But this cancer cell, what they do, either they escape from the T cells, one thing. Second thing, they'll mask themselves as a normal cell. T cell think it's a normal cell. Something called as masking. They mask themselves as normal cells and escape the immunity. So it is similar to a naughty kid, okay? So the whole thing is, see, I don't want to complicate it talking hi-fi terms and all. I want to keep it very simple so that you can just understand what I'm trying to tell. So the cancer, actually, whole concept is, people think cancer means, oh, there's something coming from outside attacking me or there's something happening. It's actually nothing like that. It's a simple imbalance in the body. See, body has a balance. There's constantly some factors which are instigating, right? Instigating for constant cell growth, cell division, spread of cancer. At the same time, there are some factors in the body which will stop that growth. So whenever there is imbalance in the body, that results in cancer. Right? See, look at the car and brake. You see, if a car is, there's a car, accelerator is there, brake is there. If the acceleration is more, brakes won't work. At the same time, if the acceleration is normal, brake is not functioning, then also you'll have accident. That's why I kept this car slide. So okay. So what are the risk factors? Okay, I told the two bands in. What are the risk factors for cancer? టీవీ చూస్తుంటాం రాహుల్ ద్రావిడ్ చూస్తాం పొద్దున్న లేవగానే నాట్ రాహుల్ ద్రావిడ్ నాట్ కమింగ్ ఐ థింక్. Yeah, I'll give one thing. You should speak other things, sir. Smoking. What the next thing? Smoking, drinking. Only your teachers are speaking.
Fast food. Preserved food.
Yeah. See, first we'll go to one thing: smoking, alcohol, and let's see nowadays the youth like him. I heard the social media club and all, and I really appreciate what sir told. Wellness club. Really, it's a good thought, sir, to have wellness club. Wellness club is not only to take care of health, but I believe there's a lot of preventive health we are talking nowadays, right? So definitely, madam is there. She's going to talk about nutrition. Mainly, wellness is a big thing right now, when for youth. So what that sir's thought is very noble thought. So definitely, any activities from a wellness club, we are always there, part of the club, sir. So drugs are very very important. Why? I'll tell you. The drugs may directly not cause cancer, but there's some chemicals which are used in the drugs. What like cutting agents? There's a chemical called phenacetin. We call it as a cutting agent, and that will use increase the volume of the drug. That is carcinogenic. That will cause so many cancers. So it is important also. People, it is started as a style. People will start smoking or drugs just as a style statement. Then it will become a habit. Then it will become addiction. Okay, you should be very careful. And yes, already you told me the next slide. Food is exactly junk food, excess fatty foods leads to obesity, and that is known to cause many cancers like uterus cancer, breast cancer, ovary cancer. Similarly, preservatives. So preservatives are not because madam is going to talk about it. Nutritionist is there here. I don't want to take her topic and talk, but the preservatives, most of the preservatives are known carcinogenic and chemical exposures. Chemical is not only from the industry, the industrial chemical exposure is there, pollution is there, and all the chemicals which we take in food. A lot of pesticides are there in the food, in the cool drinks we drink. So we should be very careful about that chemical exposure also. See, this is what I meant. Okay? Any food which you are going to eat should spoil in 48 hours. మేడం వాస్ టాకింగ్ మన పాతకాలంలో ఎట్లా ఉండేవాళ్ళు అంటే పాతకాలంలో ఫ్రిడ్జ్లు ఉండేవి కావు, ఇవన్నీ ఉండేవి కావు, మనం ఫ్రెష్గా చేసుకుని తినేసేవాళ్ళం అంతే. మేడం కరెక్టేనా? We used to get Saturday, Sunday, we used to finish that whatever tiffins used to make. By Monday it used to be over. Fridge lo undevi kavu and whatever see any packed food, preserved food, anything which is not spoiling in 48 hours is harmful to your body because they have preservatives. So, can you give an example of radiation exposure? At least one, only one. Perfect. Yes, ma'am. And some kind of infections like HIV, HPV, human papilloma virus, they also cause cancers. And see, previously when we used to study some 20 years back, if somebody is asking, sir, what is the cause of cancer, we used to tell smoking, drinking, hereditary. Only 3 answers we used to give. But now this hereditary has come down so much in the list. It has come down so much. There are so many other factors causing cancer now. See, this is what happens when you talk in phone for more than 15 minutes. So we were talking about balance, right? When you can use earphones and listen, not keep like phone like that. Definitely, it increases the amount of radiation emitting. See, we are talking about risk factors. Now we are talking about breaks. Now I expect this answer from students. Please, can you tell me? Very good. Yes, no, you can speak anything. He's giving answers, right? Lack of sleep. Yes, beautiful. Yes, ma'am. Lack of sleep. Students can speak. Don't feel relaxed. Poor diet. Very good.
Stress factors.
We don't have to hide a mark. You can stand up and answer. Why are you hiding after giving the answer? Exam mark le maatledu evarki. Well, I'm trying to understand. Meeku anta vacho ante telusukunna antakante.
Cooking breakfast.
Okay. Now we'll go in a little order. Okay.
Stress.
Yeah. ఇది ఎవరు చెప్పలేదు చెప్తారో చూస్తాం ఏంటి ఎమోషన్స్. See, this is become
Stress,
very important. Yeah, masters. See, did you really understand? This is one thing I want to. Sir, ఇందాక మీరు wellness club అని చెప్పారు కదా. You definitely require. I don't. You must be having a psychologist. Is very very important. Because nowadays, lot of negative emotions and it has shown to cause cancer. అంటే cancer ఏ విధంగా అంటే it will reduce the immunity. ఎనీథింగ్ ఎనీ హేట్రెడ్ కానీ మన రిజెంట్మెంట్ అంటాం హేట్రెడ్ అంటాం కోపం ఎమోషన్స్ అంటే ఏం వాళ్ళ పక్కన తిట్టండి ఏం కాదు ఇంట్లో హస్బెండ్స్ నా తిట్టండి ఏం కాదు నాట్ గోయింగ్ టు లీవ్ యూ యూ కెన్ నో యూ నీడ్ టు టాక్ టు సమ్వన్ మనం మళ్ళీ హైడ్ చేసుకుని యూ టేక్ హెల్ప్ సో మెనీ ప్రొఫెషనల్ హెల్ప్ ఇస్ అవైలబుల్ నౌ డేస్ రీసెంట్లీ sorry, what's your name? No, come, I want the information. I heard there's an app, new app has come where you can get someone to talk and I do. I have an idea about it. I said 2 days back, somebody told me. I was giving a talk in High Court. Somebody told me, sir, now there is an app where if you want someone, you can get and talk to a person. But be careful, don't get into those apps. You don't know whom you are talking to. So it's very important here because I'm stuck with this word because I have personally seen because Madam Chepani, most of these things won't be in our textbooks. Most 80% of what I'm speaking is from my experience only, with my interaction with patients. And when I go to talk, people will ask me some things. With the interactions only, I'm getting this knowledge. Okay? And there's some changes happening in the body which will reduce the immunity because some gene changes happen that will also affect the immunity. Yeah, somebody was telling me lack of exercise. Ma'am, sedentary lifestyle. Yes, sedentary lifestyle also is known to reduce the immunity. Excess sugars. My God, our nutritionist was not even having a tea. I got scared. But excess sugar, can have tea and coffee. But excess sugars when I take, especially see when it comes to cool drinks, they add so much of sweetener. They don't add sugars. They add so much of sweeteners. It is very high quality sugar and lot of calories are there. You should be very careful. That's why when you are having the colas and all, you should be really careful. So you understood what is the importance of exercise. Sitting is news. If you are sitting continuously for more than 6 hours, it is equal to having cigarettes, smoking cigarette, okay? But it doesn't mean they should go to have cigarette. So again, some kind of infections, again stress, somebody was talking, some girl was talking about stress, yes. Less sleep, very good. Not only you see this sleep not only affects the immunity, it affects so many things in our body. Brain functioning, heart functioning, memory, depression, so much. So you sleep adequate time. It depends on your body. Some people sleep for 6 hours, some people sleep for 7 hours. That's enough. Sleeping more than that is oversleeping. Okay? 6 hours, 7 hours is enough. But you need that sleep. Because again, for the next day, body has to get ready for the next day activities. See, when you have a picture like this, we have been talking so much about tobacco, but the most common cause is diet. And diet is the most common cause of cancer. All the things are less significant. The most important is diet. After that, tobacco and radiation, other things come. So it's very important to just have an idea about what are the symptoms of cancer. Usually, the body gives warning for us. Cancer doesn't happen overnight. Right? In movies, we see tomorrow, suddenly morning the hero gets up and he says has blood vomiting, or he has headache and they'll tell brain cancer you have. No, it doesn't happen at all like that. Cancer ఎప్పుడు కూడా మనకి symptoms ఇస్తుంది. We'll get warning at least few months before. Some changes are seen in the body. Only thing is we ignore the changes. The changes at a particular parts. For example, when I have breast cancer ఉందనుకోండి, breast లో గడ్డలు రావటం, swelling, so ఏదైనా swelling ఉంటే swelling పెరగటం, స్కిన్ లో చేంజెస్ రావటం, అలా ఎక్కడైనా సరే అల్సర్స్ రావటం, బాడీలో అల్సర్స్ తగ్గకపోవటం, చేంజ్ ఇన్ ద బౌల్ బ్లాడర్ హ్యాబిట్స్, అంటే ఒకసారి ఆకలి తక్కువ ఉండటం, తిన అరక్కపోవటం, వామిటింగ్ అవటం, మోషన్కి వెళ్ళే బ్లడ్ రావటం, ఇవన్నీ కూడా ఏదో ఒక చేంజెస్ అనేది బాడీ ఇస్తుంది మనకి. సమ్ సిగ్నల్స్ విల్ గెట్ దట్ సిగ్నల్స్, అది మనం ఇగ్నోర్ చేస్తూ ఉంటాం. సో హియర్ అవర్ ఎయిమ్ ఇస్ టు ఫర్ ఎర్లీ డిటెక్షన్ అండ్ ప్రివెన్షన్ ఆఫ్ క్యాన్సర్. సో దట్స్ వాట్ వీఆర్ ట్రైంగ్ టు డూ. అవేర్నెస్ అంటే అబౌట్ ద సిమ్టమ్స్ ఆఫ్ క్యాన్సర్. అందుకే I wanted to really involve all of you people, so you create, because you people are ambassadors in society. నా వాయిస్ కొంతమందికి వెళ్తుంది, కానీ ఇంట్లో మీరు చెప్తే ఖచ్చితంగా వింటారు. ఇలా దిస్ ఇస్ ఇది అంటే యూ షుడ్ బి అవేర్ ఆఫ్ దిస్. గో టు డాక్టర్ అని ఒకటి చెప్తే చాలు, మీరు ఏం చేయక్కర్లేదు. దట్స్ వెరీ ఇంపార్టెంట్. స్క్రీనింగ్ అంటే ఏంటంటే, స్క్రీనింగ్ మీన్స్ యూజువల్లీ టేక్స్ వెరీ లాంగ్ టైమ్ As I said, for cancer changes to develop in the body, for development of cancer, it will take very long time, few months to few years. So there will be a critical point where we can catch the disease before it becomes cancer. So just look at this slide. This is uterus picture, my uterus cervix center actually. See, look at the normal cell and low grade, high grade, finally it becomes cancer. So if you catch the disease at second and third quadrant before it becomes cancer, we can totally cure the cancer. So this is what I was trying to tell, because from the time we get the changes happening in the body to the actual symptoms of the disease, there is a critical point when we can catch the disease. That's called screening. This is the main challenge. That's what I was telling you. We are talking about. We're talking about embracing equity. That this is where I really want to get that equity. So what happens? People, especially people, I do not use the word people, women, they don't go to doctor because of fear. First thing, doctor ఏం చెప్తాడో, ఏం టెస్ట్ చెప్తాడో డాక్టర్. Then and again, second, the family factors will come, social factors will come. They'll keep everything in front of them. This kids' studies, education, school fees, everything will come before their health. But this is where I really want that change. They don't come to doctor because of fear of diagnosis. And second thing is denial. They'll think cancer won't affect me. Because see, many times when I talk to patients, some of them late చూపించుకోవాలంటే ఇట్లా సార్ క్యాన్సర్ పాపం చేసాడు వచ్చింది సార్, నాకెందుకు నాకు రాదు క్యాన్సర్ అంటారు. I don't have answer for that. అంటే దట్ ఈస్ ద అవేర్నెస్ లెవెల్ దే హ్యావ్. సో అట్లా కాదు, క్యాన్సర్ ఎవరికైనా రావచ్చు. సో అలా డినైల్ మోడ్లోకి వెళ్లకుండా, భయపడకుండా డాక్టర్ని కన్సల్ట్ చేయాలి. దట్స్ ద మెయిన్ స్టిగ్మా. When you go to Western countries, what is happening? We have a strict screening protocols for everybody. Whether you like or not, you have to go and report to the hospital. మన అట్లా కాదు కదా, మన ఇష్టం, వెళ్తాం లేకపోతే లేదు. కానీ ప్రాబ్లమ్ ఏంటి? ఫీమేల్స్ హైడ్ ఇట్. The most important thing, they are the core of the family, they are the core of the society. But they neglect their own health. That's where the whole burden is. So this used to happen some 10-15 years back. People used to ask, sir, we are having cancer in our family. Do you think I can get the cancer? At the time, we didn't have any answer properly. మీ మదర్కి వచ్చింది కదమ్మా, మీకు వచ్చే అవకాశం ఉందమ్మా అంటే we used to give a vague answer, వచ్చే అవకాశం ఉందమ్మా. But we didn't have proper, exact, authorized or authentic reply at that time. But now we have genetic testing. So if somebody is having a family history, especially mother's side or one side, somebody is having a family from father's side or mother's side, definitely if you go for genetic testing, we will know the person is at the risk of developing cancer or not. It doesn't mean that somebody is going to get cancer, but we can know the person is at risk of developing cancer or not. So what will you do if you know if you have risk of cancer? What will you do? Why you should know? Now test, okay. Anything else? Movies చూస్తారు కదా, ఇంగ్లీష్ మూవీస్ చూస్తారు లేదా? You have heard of Angelina Jolie? Yeah. Why movies పేర్లు? Why in this context why you remember Angelina Jolie? No, అంటే she underwent breast removal and she didn't have cancer and she has high risk of breast cancer. So she removed, but in India this is not common. But only thing, she can go for regular health checkup. Because actually, if you know the risk, many people, especially in Western countries, they undergo removal of uterus, ovaries, breasts, and all. But in India, that practice is not common in our countries. But at least we can go for regular health checkup. So when it comes to females, see, I'm only going to talk about things where screening is available. I'm not going to talk about all cancers. Just I'm going to give a brief idea about what are common cancers. So when it comes to females, the most common is breast cancer, cervical cancers. Again, we have lung cancers, head and neck cancer, head and neck ante notlo gantlo vache cancers, and intestine cancers. See, just look at this slide for a minute. So previously, breast cancer was common in European countries, Western countries. Previously, cervical cancer in తెలియపంటే గర్భసంచి ముఖద్వారం ఉంటుంది, గర్భసంచి వచ్చే క్యాన్సర్. So previously, cervical cancer was number one in India, but now breast cancer has become number one. We are equal to, we are at par with Western countries. but still cervical cancer is number two cancer in India. And when you go to a rural population and low socioeconomic population, still cervical cancer is very common. So these are the cancers which you can detect early with the help of screening: breast cancer, cervical cancers, colorectal cancers, and head and neck cancers. So what is significant of October? You see so many walkathons, talkathons, marathons, so many things happen in October. What happens? What is the significance of October? And the pink color. And the only first two rows are మాట్లాడుతున్నారు అన్ని ఎవరు మాట్లాడలేదు.
Breast cancer awareness.
Very good, very good, very good. So it can affect, so 1 in every 8 females is at the risk of developing breast cancer. See, apart from all the risk factors I told, there are some other risk factors, especially familial risk factors are common in breast cancer. Somebody is having someone's mother's mother, or mother's sister, or someone's own sisters or first cousins, if they are having breast cancer or ovary cancer, they are at high risk of developing breast cancer. And apart from that, again, some nullity, infertility, these are all also risk factors of breast cancer. See, this is something which I really want you to understand. What happens for a female from the time of puberty till menopause? So many changes happening in the breast. So you should be just know whether a change is a physiological normal change or an abnormal change. That you should have an awareness. I told suddenly there is a new lump in the breast, or increasing size of existing breast, or changes in the skin, changes in the nipple, or any discharge from the nipple. You should be a little aware of that. And don't panic, because most of them can be hormonal. 80% of these things can be hormonal, okay? And some of them are because of infections. So first, don't get panicked. Some abnormality is there, don't get panicked, but definitely go to doctor and get evaluated. There is a screening guidelines are there for breast cancer, because after the age of 20 years, they say every month, monthly breast self-examination recommended. Similarly, after the age of 40 years, once in 2 years, at least once in 2 years, you can go for mammogram. But if somebody is having a family history, we call them as high risk. So they can go little early also, maybe as early as 35 years also they can go, but they have to go every year for mammogram.
Safe, sir. Is screening safe? Like
Yes, yes. Yeah, you can ask questions. Yeah, she has a doubt in screening cells. See here what happens, whatever radiations or whatever device you use, it can be very low dose of radiation. Not only digital mammography, if you want, you can go for ultrasound mammography. That has no radiation at all. This is very important topic for you. Same thing, still as I said, it is second most common, and it causes, the main cause is because of different kinds of infections. See, look at the pattern here. Still, it is very common in developing countries. If you look at that picture, it is still common in developing countries. So there are so many risk factors. Most common I can tell is something called human papillomavirus. Human papillomavirus infection causes. It's definitely is known to cause cervical cancer. And someone is having low immunity, like somebody has HIV or some other cancers like breast cancer, they are at high risk of developing cervical cancer. Yeah, we don't prefer to talk about the age of ladies, but here it's important. Okay, according to guidelines, they say as early as 20 years, but at least practically after the age of 35 years, you should go for cervical cancer screening. In many centers, both pap smear and human papillomavirus kits are available. If when both are available and the report is normal, you can go for testing once in 5 years. But in many centers, there will be only pap smear available, most of centers. In that case, the report is normal, at least once in 3 years, you can go for testing. If there is any, madam, you can't material పంపిస్తాను, I will share with you. Don't worry. So if there is any abnormality, so first thing in infection is that get the infection treated. If any abnormality is found, then every year you have to go for cervical cancer screening. So now a lot of talk is going on about vaccines. Right? Anyone wants to ask anything about vaccines, you can ask, please. Anyone is having any doubt? Because now the recommendation is from the age of 19 to 14 years till the age of 45 years should take cervical cancer vaccine. That vaccine in the body, human papillomavirus is known to cause cervical cancer vaccine. So there's a cervical cancer. So there's a vaccine against that virus. So now anybody who has doubt about vaccines, please ask. Because so many, yeah,
How effective I have already taken.
it is good, I'll tell you. New vaccines are coming. Yes, it is very effective, Amma. Why? I'll tell you because there is a question. Same question is there because many people keep asking me those questions. I kept as questionnaire here. So people ask why the age of 9 to 14, 9 to 14 years. That's the age because there's a maximum immune response in that age. If you give in that age group, you get maximum immune response. That's why that age group is selected. So ideally, it's better to take before 18 years. But as ma'am said, is it effective for me? That's the question that many people have. See, usually we get cancer by regular or constant use of what called insult to the body. Only one exposure or few exposures of the infection won't affect the body, but if you are taking the vaccine, it is going to help you to fight further infections. And nowadays we are talking so much about menstrual hygiene because it's also very important. Now, nowadays people are talking about biodegradable sanitary napkins, lot of talk about personal hygiene, menstrual hygiene. So this is very important to create that awareness, especially in the rural population and low socioeconomic population. So till the age of 45 years we can take them, it is still effective. Somebody asked me the question, can we take after the age of 45? You can take, actually see when we are recommending screening till the age of 65 years, nothing wrong is taking, but according to guidelines it's still 45 years, still you can take it till the age of 65 also you can take. So it doesn't cause any serious complications. People have doubts, it will cause severe reactions or it does cause infertility. So many doubts are there. It won't cause any reaction because we don't use the active virus in this one. We use viral-like particle in this vaccination. So serious complications are not expected. Till now they are not reported actually.
Only one dose is enough, sir?
No, madam, 3 doses. And when you are giving from 9 to 14 years, only 2 doses are enough. After the age of 14 years, 3 doses are enough. Ma'am, you 3 doses తీసుకున్నారా?
Yes, sir.
No, lung cancer also is a very common cancer. Because we're talking about smoking, just I wanted to keep that slide. And he's the one, and Kar, he is the father of no tobacco movement. Similarly, intestine cancer is also very common. Only thing is, they say after the age of 50 years, once in 5 years, go for colonoscopy. If somebody is in for family history, go for test for every year. And nowadays, you don't have to go for scopy. There's something called capsule endoscopy. If you take that like a tablet, it will scan the whole body. It will go into the whole intestine and scan the intestine. And similarly, when it comes to prostate in males, we have something called PSA test and regular ultrasound test after the age of 50 years. Well, just I wanted to give a brief introduction. What happens to because people ask after finishing the talk, so you didn't tell what happens when the patient comes to a doctor, what they will do. Usually, we'll examine clinically, then we take them for some different, depending on the type of cancer we suspect. Different scans are available, like CT scans, MRI, or PET scan is available. And then we have to take the biopsy from that particular part. We book a pariksha piece test, biopsy test is done, and further studies are done on that biopsy test. And so many different latest treatments are available nowadays, like laparoscopic surgery, robotic surgery. When it comes to radiation, there's something called image-guided radiation, stereotactic body radiation. In chemotherapy, also people used to think previously we used to see people with all bald head, hair gone and all, right? So nowadays, latest chemotherapy drugs are available. Then targeted therapies are there, immunotherapy, hormone therapy, different treatments are available. So why I'm telling all these things is you should not worry. When cancer వస్తే ఒక క్యాన్సర్ అంటే క్యాన్సర్ అనేసి ఒక వర్డ్ ఉండేది. Now you don't have to worry. Cancer is curable till third stage. Previously we still only first stage only curable. Now till third stage cancer is curable with so many latest advancements. So now I want the last. I'm coming to last. Ma'am, any questions you can ask, please. Last few slides. So how do you want to prevent the cancer? It's important, right? One is trying to maintain an ideal body weight, okay, and have A balanced diet. No, ma'am will come after me. Ma'am will tell what is my balanced diet, what you should eat, what you should not eat. If I tell that, you lose interest in my topic. So I will not talk about that. And physical activity. Physical activity. Now, what do you mean by physical activity? That's such a physical activity గురించి. Physical activity అంటే ఏం కరెక్ట్గా చెప్పండి నాకు. అంటే చాలా మంది చెప్తే ఏం చెప్తా అంటే నేను రోజు వంట చేస్తానండి, పైకి బట్టలు ఆరేస్తాను, కిందకి వెళ్తాను, నడుస్తున్నాను అంటారు. అది సరిపోతుందా? అంటే దేశే అంటే అట్లీస్ట్ 40 minutes of voluntary physical activity 5 days a week. You can go for gym, Zumba class, gani, yoga, gani, whatever fits your body, walking, whatever fits your body. At least voluntary 40 minutes of activity 5 days per week. That is called active life. We already spoke about that. So adapt healthy lifestyle, no smoking, no drinking, no drugs. Others, both personal hygiene is very important, especially for cervical cancer. And vaccination, please, all of you, you must take vaccination. And you should focus on your mental health. And regular health checkup is very important. So this is what we are talking about, sleep habits. This is my favorite slide actually. So you think, okay, I'm angry with someone, nothing will happen to me. See, every emotion has effect on the body. I'm just stopping here for some time, just look at it. Every emotion you have has an effect on body. Don't think, okay, I can be angry with someone or something I can keep in my heart, nothing will happen. No, it's going to affect your body, okay? So take home message చెప్పండి, last slide, take home ఇంత విన్నారు కదా. So what you're going to go home and tell? మ్యామ్ మీరు పడిపోద్దు మేడం, కూర్చోండి. Yeah, just what is the take home message? 2-3 points చాలు. I'm not going to speak more.
Regular vaccination and health checkup.
Very good. Anything else?
Also concentrating on our mental health as well as physical health.
Perfect. One thing, be aware of yourself. It's very, very important. See, you should be aware of what you are thinking, what you are eating, and how the body is reacting, any changes happening in the body. Just if you are aware of it, that's enough. Second, don't fear. If somebody is diagnosed with cancer, please don't fear. And most of the cancers can be detected very early. See, as I was saying to sir, actually, I'm fond of Singaraju Cancer Foundation. We do a lot of in cities and doing a lot of cancer awareness programs, and in the rural areas, we are being regularly doing cancer screening programs. So, if somebody who is interested in doing voluntary work or some social service, we are also providing them with certificates. If somebody is coming, so many interns are doing, actually medical interns are coming, and if anybody is interested, definitely you're all welcome to join us. And thank you so much.
Thank you, sir, for enlightening us. It's open.